Hello friends, good afternoon. Today I will tell you trip, tips and tricks for external approach of mandibular nerve block. So coming one by one. So first of all, the landmark identification is must. And patient position. Patient position. Patient should be in the fully supine position with their mouth wide open, not wide open, but we can instruct patient to slightly open the mouth and palpate with your finger the mandibular notch, which can be palpated just anterior to the and just not anterior, not just anterior but anterior to the tragus and below the zygomatic arch. So if you will instruct the patient to partially open the mouth, so you can appreciate the depression. That depression is of our interest. So what we that depression is of coronoid notch. Okay. So this is must. Now coming to next. This picture is not loaded, so that I'm sorry for this, and I have marked here the lateral pterygoid plate. It is of our importance. I will tell you later on. Now in this picture we can see that this is the infratemporal region before the nerve enters to the mandible. So what is there? This is the mandibular notch. We feel this mandibular notch, and this is the zygomatic arch, and somewhat here tragus will lie. Okay, this is the external acoustic meatus. So anterior to the tragus, below the zygomatic arch, you will feel a depression which is mandibular notch, and this area will be our area of interest. Understand? Now, and patient should be in the supine position. Okay. Now coming to the needle insertion and alignment. Needle insertion, I will back to the previous slide and I will tell you. In supine position, after painting and draping our area of interest, this area, we palpate this depression, and in area with 1 to 2 ml of lignocaine, we numb this site, and with help of 22 gauge spinal needle, the area which is of most depressive part is of our interest area, interested point, your point of interest. So after anesthetizing this area, our needle insertion must be at the right angle to the skin surface. Right angle. So what happens? Our needle many times means almost all the time, if we are going right angle, then while inserting the needle, our needle will hit this lateral pterygoid plate, which is situated here. So, and behind the lateral pterygoid plate, this nerve lies. It passes down and enters to this space which is here when it becomes the inferior alveolar nerve. So when go inside, we hit this lateral pterygoid plate. So our entry should be at the right angle to the skin surface. Nerve contact and injection. This bone contact is of lateral pterygoid plate. ठीक है, when we pass into the mandibular notch. Now when we have touched the lateral pterygoid plate, what we have to do, we have to come, suppose this is lateral pterygoid plate and we hit here. So we have to come back, we have to move our needle posteriorly, and one point will come when the needle will hit this nerve and there will be paresthesia. Okay, as soon as the paresthesia develops, patient will tell you and it is confirmed that we are on the nerve. Now, as soon as we hit the bone, we withdraw and walk off posteriorly, and after aspiration, we slowly inject the drug with local anesthetic or whatever we want. If we are doing the procedure for pain purpose, then we can phenylize, or we can inject the alcohol, or simply if we want to block, then 2 to 3 ml of local anesthetic solution. Now, what can be the potential complications? Anatomical variations. Number one, the complication can be due to the anatomical variation. So we have to recognize that anatomical variability which can lead to our failure. Number two is which is most important, is the intravascular injection of the local anesthetic and other drug. So we should carefully aspirate before any injection, okay, to prevent anesthetic from entering to any blood vessel. Number three is the paresthesia. A patient feeling paresthesia is often a positive sign, as I told you before. It's a positive sign that your needle is on the accurate place. And failure of bone contact means lateral pterygoid plate. If we are not hitting the lateral pterygoid plate, then the needle depth may be too deep, and it may hit the other soft tissues of the opposite side, and it may go in the oral cavity. So it is must to hit the lateral pterygoid plate. So I think you will like this information, and if you like the information, kindly like the video, share the video and subscribe my channel. Thank you very much.